My name is David Weiss. I'm an associate professor in the Department of Health Professions and Family Studies. The question comes up is that who will really be affected by the potential changes? One, from an economic point of view, the president has said repeatedly, not that necessarily people have heard it, but he said repeatedly that no individual earning less than $250,000 a year will see any tax increase. So in other words, the money to pay for the uninsured and to some of the changes that he is proposing will come from increased taxes from the wealthiest of individuals, or those earning over $250,000. It's reasonable to expect that those people earning over $250,000 would most probably object, saying there's some unfairness to it. But on the other hand, as Americans, we are of the belief that the more you earn, the more you pay, and that there's some notion about what's fair in terms of a contribution. Of course, we can argue about what level is really fair and how much should individuals pay for this. Individuals earning less than $250,000 a year have been told, not necessarily they believe it, that there will be no increases in taxes. So part of the money will come from there. Also, the suggestions are that monies can be saved by streamlining the system, improving the system, one of which we've already spoken about, namely the introduction of electronic media and electronic information to help move things along, reduce errors, reduce expenditures, reduce waste, reduce further treatment when accidents happen or mistakes are made. Thirdly, the concern about who's paying for it and how they'll pay for it is reduction in fraud. Now, interesting enough, when we think of fraud, very often we think of patients who try to rip off the system. Statistically, we know that those who are engaging in fraud, for the majority, are not the patients, but the providers. So doctors who are overcharging, hospitals that are overcharging. So it's not necessarily the patient himself or herself, but the providers themselves. So if we can somehow gain access into the control of fraud, there can be considerable savings coming from those areas. This is all the hope. In addition, there's been a push, the president has pushed for this, namely in the area of preventive care. There's the best way to save money. Don't get sick. Not going to happen in all cases, but can we do a better job of preventing illness before it actually happens? Well, you have to talk about a major cultural change in the United States. We do things in a big way. I've already said we spend the most of healthcare system, but we can go further by saying we eat the most, we drink the most, and most probably maybe sleep the least, I think, of anyone. So that doesn't fit into the scheme. But clearly we're eating too much. Just the latest data show that portions have dramatically increased. And maybe we all belong to the old clean plate club that our parents have encouraged us. Make sure your plate is clean before you leave the table. So we're eating more just in terms of quantity of food. I tell my students, if you want job security in the future, go into something relating to diabetes, because you're going to have dramatic increases in illnesses of diabetes and illnesses relating to it, such as circulatory problems and various types of breathing problems, neurological problems, all spinning off of the diabetes. Going back to the notion of preventive care, how do we prevent diabetes? Well, diet is one, exercise is another, but now you're talking about making major cultural changes in people's lifestyles. All of us, I'm sure, have started the New Year's resolution saying, gee, I'm going to exercise more, I'm going to do a lot more to take care of myself. And most probably by February 1st, those resolutions have bit the dust, and you'll have to wait till next year to come up with your new list of resolutions. So the president is pushing, and others have pushed the idea of preventive health care. Major killer in this country, heart disease. Major killer in this country, cigarette smoking, still cigarette smoking. 500,000 deaths a year relating to cigarette smoking. All areas in which potentially individuals can have the control of whether or not they get sick or don't get sick. Interesting enough, historically, illness was most probably considered a random act. That's why very often, historically, one resorted to religious attempts to relieve illness. Read the book of Job, and you'll hear the question being asked of Job, and also many suffering from serious health diseases. And the question is, why me? Why me? What did I do? What did I do wrong? What didn't I do right? How have I somehow offended the powers, the divine powers, and now being subjected to illness? Well, how can we somehow grab control over those illnesses that we, by our lifestyle, by our own behaviors, are bringing about the illness? Interesting enough, speaking to smokers, they'll tell you, yeah, they know all the downsides of smoking, but they continue to smoke. Perhaps it's the nicotine, it's the addiction, or perhaps it's just the social behavior patterns that have been so ingrained that you continue to do it. Interesting enough, when we look at cigarette smoking, it's down in every age group in the United States except one, and that is young women, usually late teens and young adults, so between the ages of about 17 and 26. Why? Hypothesizing that many of them use it as a weight control. For many teenagers who do start smoking, it's something to do with your hands. It's a social thing to do. So the interesting notion about preventing illness is going to take on greater and greater concern. Whether or not it'll be cheaper, most probably not. Interesting enough, people think that preventive care is cheaper, not necessarily, because now the pharmaceutical industry has come up with all sorts of drugs to keep you healthy. That's fascinating. All sorts of drugs to keep you healthy. So now you have to pay for pharmaceutical supplies to keep you from getting sick. So preventive care isn't simply eating better, exercising more, being better in terms of mind and body. I think perhaps one of the best things we can do for the health of Americans is guarantee every American a week in Disney World and Disneyland. If anyone's ever visited, I'm sure many of you have, you walk out of there feeling great. Mind, body, spirit, all in unison. And we do know the better you think, the more positive you think, those messages get translated into the body, producing such things as endorphins, which help you fight illness. Interesting story, complicated story, but one that can be concerned about preventive health care.